mHealth is the area I talk about. You know, it's to me, mobile health is any place outside the four walls of a clinic. Increasingly, you know, to me, it's telehealth. I have a broad definition of it, but it's getting to the point, and you know, it drives some providers crazy. You know, how can you diagnose a patient without touching them, right? I mean, it's just so ingrained into healthcare. But I mean, we learned a lot during COVID, right, about telehealth. We also learned a lot about the limitations of telehealth. Right now, telehealth reduces costs mainly because providers aren't paid the same amount of money. Until COVID, almost every case, if you saw a patient, you were not reimbursed. You know, I don't want to always take the physician side on costs, but I mean, there's a cost of time, right? I mean, providers, I mean, it's not, you know, a 24/7 job. They have lives too, right? And there's burnout. Right now, if you send your doctor or nurse an email and they spend time to reply to it, they are not paid for that time that they're replying to it. And also that email could turn up in a court case if it's not written perfectly, if there's any misinformation. So it's really, I mean, the liability issues are huge. The lawyers always make out, and it's an issue. So anyway, I'll stop with my lecture, my worldview. Extending the health of reach care, we have efficiency, speed, and location. Engaging patients and improving convenience. Wearables, I don't know if any of you have used the wearables. I don't. Simply because I don't think they're valid, but it counts how many steps, or, you know, can look at your BP. But, you know, you can see a time where, I mean, this is kind of scary when we look at all the other, you know, sort of government activities going on potentially for surveillance, right? But where you have a chip, and it's possible to monitor all of your physical activities as well as your geolocation. And then there's the telehealth, but ultimately, you know, we want to reduce costs. What we want to do is empower the patients. I mean, we want to, and I wish more people would do it. You know, I wish more people wouldn't use Google, because, you know, Google monitors everything you do, and or wouldn't use Facebook, but people do, and so there's, you know, there's huge privacy issues, particularly if you're talking about your health. You know, if you send an email about your health, you could try to send a Gmail of something about health, and you'll start to see ads pop up about that health, unless it's about suicide or mental health. So there's all that targeted advertising out there. But anyway, there's now more than 320,000 health apps out there a day, 200 added a day. Nobody's making any money on it. But we think that younger people are going to be more willing to be engaged with their health.